On this episode of CARPe diem, Zoomer Health, heart and stroke.
Began feeling a little lightheaded, thought maybe I should talk to the paramedics.
Let's get to the heart of the matter.
I want to keep a healthy heart.
Learn how to reduce your risk.
I can't always say what I want to say.
And age safely with doctors Era Elmajian, Shanta Chakrabarti, and Preet Chahal.
CARPe diem. Seizing the day for Canadians as we age.
Welcome. Almost 1.6 million Canadians are living with the effects of heart disease and stroke. I put together a panel of 3 medical specialists who will share the importance of oral, heart, and brain health as we age. And Dr. Era, let's start with you. What is the correlation between oral health and heart?
There are 3 factors that could affect heart issues from the dental point of view. One of them is heavy metal toxicity. Secondly, the microbes that are harmful to the heart. And thirdly, the production of nitric oxide.
Wow, that's interesting. It's very interesting, yeah.
What would be your top 3 causes of heart problems?
Nowadays, we tend to talk more about like cure and fixing things, but it's a spectrum, and prevention should be the top one. Prevention, prevention, and prevention. Through diet, exercise, healthy living, healthy food, and that sort of thing should be the focus. That's
and as a
take.
neurologist, would you agree with that too?
Absolutely. Prevention, I think, as we all agree across the board here, is the key thing to mitigate the onset of disease rather than treat a disease. And I look forward to sort of hearing and participating in this conversation about it.
Is there a big correlation between brain and heart?
Absolutely. I mean, the simple way I put it is stroke is a plumbing issue, not enough blood getting to the brain. And guess what? We only have a single pump in our body, and that's heart. And we need to be able to make sure heart works well to provide enough blood across the sort of the plumbing to get into the brain.
Fascinating stuff. Now, we asked, how is your heart health?
I think my heart health is pretty good. I get regular checkups and try and keep myself in good shape.
I feel that I have excellent heart health this time, and I'm taking care of myself.
It seems to be good. You know, I do take things, I take a lot of supplements for this and that. And
I have a little hypothyroid, but I take a very small pill once a day.
I'm in contact with one of our local Vancouver hospitals because I want to keep in good shape and I want to keep a healthy heart.
Are they on the right track?
I would say absolutely. To me, life is like driving a car. You're driving, taking care of everything. If a tire punctures, you repair it and move on. You maintain the car. You fill up with gas. You do your annual maintenance. You take care of the interior and the exterior, and you enjoy the journey with others.
Yeah, and that's exactly your whole practice.
Actually, I'm very proud of my profession because from early 70s, we preached prevention by seeing the eugenist and the hygienist, because as I believe strongly that the microorganisms that could fester if you have not good oral health and a bunch of materials in your mouth that create galvanism could produce toxic effects to the heart, and has been proven in many medical articles connecting heart health with the oral microbiome.
And is that something that's widely discussed in your circles?
So there are 2 ways of doing it. One is the direct effect of the bug. Like you can get infections of the valve, which is called endocarditis. You can have what we call an abscess in the heart. But something that we know a little bit, but we are learning more, is what we call the immune parts. Like one of the major parts of, or one of the major causes of heart disease is what we call rheumatic heart disease, which is not due to the bug itself, but an immune response to the bug, which thinks a part of the heart muscle or tissue is foreign and then reacts to it directly or indirectly.
Interesting. We're going to take a short break. When we come back, we're going to focus on heart health.
Still ahead on CARPe diem.
They're made for a lay rescuer to use as opposed to someone with advanced certification. So anyone should be able to pick it up, open it up, and listen to the prompts and go from there.
CARPe diem. Seizing the day for Canadians as we age.
In this segment, we're talking about the heart. Now, what are the symptoms, doctor, that something's wrong?
What happens with heart health is, especially in women, symptoms may be very, very non-specific. Like the typical example is we teach that for a heart attack you would get severe chest pain, and that is true, but women may not be getting it. So I think there's a lot of things need to be done about educating everyone in the society to make sure that we are on top of prevention, symptom, early recognition, early treatment, and so that everyone's happy and everyone can lead life nicely. What do you think?
Well, I find, as you mentioned earlier, regarding nutrition and prevention, one of the main aspects to prevent heart attacks is the mind. Regulating of your nervous system is of utmost importance. That could happen easily by doing ancient modalities like chanting, praying, dancing to regulate.
Meditating is
meditation is very, very important.
So keep it calm.
Yes, the mind, which we tend to forget, is a huge regenerator of health.
I agree that the holistic approach of getting mind involved in our own health is an important aspect of it. You know, oftentimes we tell patients, hey, listen, go do exercise this much, this amount, and this many frequency, this many days. We find that instead of a directed approach, sometimes even a more holistic approach, hey, we got to relax you somehow. If it's meditation, if it's dancing, structured classes, the multitude of neurodegenerative conditions, and I know our focus is stroke, but things like Alzheimer's disease, dementias, things like Parkinson's disease, we've long known and studies have validated activity and mind health is an important aspect of managing these patients.
Well, I'm glad to hear that because I'm a big believer in that too. And speaking of hearts, now if someone was having a heart attack, would you know how to help?
I was riding my second Cops for Cancer tour. It's a 900-kilometer, 9-day bike ride. About 2.5 hours into the first day of my second Cops for Cancer tour, I began feeling a little lightheaded, thought maybe I should talk to the paramedics, and very suddenly the lights went out and I was in cardiac arrest.
I don't know what the average is for someone to have a heart attack or for their heart to stop, but you said 7 times.
Because people had CPR training, because people had excellent skills and abilities with an automated defibrillator.
So I've scoured the internet looking for public AEDs. They're portable devices that help save lives. I found one here at Willoughby Community Center.
In the Township of Langley, we put AEDs in any of our facilities where there's active populations, so anywhere where we'd be offering recreational activities, gymnasium activities, aquatics activities, sports activities. Out of all of our facilities, we've got 7 different standalone facilities and 13 public access AEDs in those facilities.
Okay, it's pretty hefty. This is the case here?
Yeah. Comes with your Ready Kit, which has your pocket mask and everything in there if you were going to assist with ventilation.
Okay.
When the AED arrives, it's straightforward. Open the machine, turn the machine on, follow the prompts. It's voice activated. It tells you what to do. The staff are all trained and they know what to do, but they follow the steps, put the pads on, and then let the machine do the analyzing and then decide if there's a shockable rhythm, and then it will administer the shock.
Shock delivered.
They're made for a lay rescuer to use as opposed to someone with advanced certification. So anyone should be able to pick it up, open it up, and listen to the prompts and go from there.
Like me, right?
Absolutely.
Minutes and seconds can make a difference. I get to be in the community for another as long as I possibly can before, age eventually catches up with us all and I'll need to make another career plan when police retirement approaches at some point.
Shanta, are those AED units readily available?
The answer is yes and no. That's because even if they're available, if they're not displayed properly, then people won't know. So there are programs and apps available where you can find them. But I want to take a minute, if you permit, to have a difference between a heart attack and a cardiac arrest. Cardiac arrest is a situation where your heart suddenly goes very fast, around 400 or 500 beats per minute. When you do that, the heart doesn't get time to fill, doesn't eject out enough blood, it can't maintain circulation, can't feed itself, and it cannot go to the head. If the circulation to the head is stopped for more than 3 to 5 minutes,
Right.
yeah, even if you can restart the heart, you cannot restart the brain again.
Yeah.
So when there's short circuit in the electrics, you need to reset it with an electric shock.
Quickly.
And quickly, within 3 minutes. But most of the time, by the time you call 911, there's a traffic jam, this, that. So one sees that they take the patient to a hospital, but what you don't know that most of the time they don't make it.
So technology in the place right away, that's the number one response.
Yes, and to have it visible and for people to know how to use it. So that's the key thing. That's a cardiac arrest. But a heart attack is a mechanical thing where you have a clot in one of the pipes which supply the heart muscle, and a part of the heart muscle dies.
Thank you for clarifying that. We're taking a short break. When we come back, we're talking stroke.
Still ahead on CARPe diem.
Well, I guess right now, of course, it's because I'm an astronomer, but I can't do a lot of the things that I would like to. I can't always say what I want to say.
CARPe diem. Seizing the day for Canadians as we age.
According to Stroke Canada, there are more than 50,000 strokes a year. On average, one stroke occurs every 10 minutes. That's a scary stat.
Absolutely. To begin with, I'll tell you what a stroke is, and I mentioned at the top of the show, I think of strokes as a plumbing problem, not enough blood getting to the brain. Either a stroke is because of an obstruction, something jammed the blood vessel, or the pipe burst open. By far the more common of the type are the ones where there's obstruction in the plumbing. And to recognize the signs of that stroke or stroke type symptoms is the key here, because then and only then can public access appropriate care.
So if someone has a stroke, what's the chance they will survive it?
Right, the survival rates are quite high actually in these days. The question often gets answered in a sense, and how quickly do they access medical care? And with more recent advances in stroke and vascular neurology, the outcomes are reasonably good if if the patient accesses care at a right time. And once again, going back to the idea of how quickly does the brain start dying? I just finished saying about 1.9 million brain cells are dying every minute when there's not blood getting up there. If I could take a couple of moments, Heart and Stroke Foundation of Canada has done a fantastic campaign about recognizing signs. FAST, fast. Face is the face drooping. A stands for arm, or the arms sort of slouching down. And S for speech is the speech garbled, slurred. If any of those symptoms appear, the T stands for time to act and call 911.
And do they have to happen all together?
They don't, any of them.
Any of them?
Yes.
Era, that's pretty scary.
Well, I am into the prevention aspect. And over the last 45 years of my practice, I learned how to prevent cardiovascular disease by using fungal medicine, fungus, herbal medicines, the nutrition, the enzymes, and fortifying your mitochondria. These are the little organelles in your cells that produce your energy. I'm very much into the prevention through multiple aspects, which will take a couple of shows to cover.
That's great. Well, speaking of strokes, they're not all created equal. There actually are different kinds of strokes.
So I bet you've probably never had a stroke or a heart attack before.
I've had a TIA, but not a heart attack.
What's a TIA?
Trans-ischemic attack. Well, whatever it was, something went through my brain and didn't stop, but just kept going. Just offer a second.
So what is a TIA?
Right, TIA, transient ischemic attack. Transient, as in the definition, it's short-lasting. I think of TIA as a mini stroke, but more importantly, it is a warning sign. And I often tell patients this is where patients need to seek attention. When something like a TIA happens, an acute set of symptoms come on, whether it be speech, whether it be not appropriate vision or arm issues, leg issues. If they resolve on their own, it doesn't mean that they are out of the danger.
Right. Recognize the signs and do something about it. We sent Keir to visit our good friend, UBC professor Dr. Jamie Matthews, who suffered a stroke in 2018.
At this point, I'll ask Jamie Matthews to pick up the story. I just noticed your shoes.
First, I'm going to tell you about how we're rewriting the cookbooks, the recipe of the universe.
Well, it's not every day that you get to meet a famous Canadian astrophysicist, and I think he lives right over here. It's just so you can say hello.
Well, whatever.
Order of Canada recipient Dr. Jamie Matthews is known for popularizing science and his eclectic style. But in 2018, he suffered a stroke and developed aphasia.
And aphasia, from my understanding, it inhibits communication.
Yes.
What do you find is the most frustrating part about living with aphasia?
Well, I guess right now, of course, it's because I'm an astronomer, but I can't do a lot of the things that I would like to. I can't always say what I want to say. Yeah, it's a plaque. It's a plaque.
Black plaque?
No.
Oh.
It's a plaque.
A backpack.
Yeah.
A backpack. Ah.
The other thing is that I can't write sentences. Yeah, this is my thing.
Your degree?
Yeah.
Like what's next?
Well, so the Royal Astronomical Society of Canada is having a big thing here.
Okay.
And I have decided to speak.
Do you think you're going to be ready?
I have to. I have to be.
And that represents a completely new era and something almost as exciting as making eye contact with planet Moses.
As Jamie's condition continues to improve, he plans to inspire more Canadians about the mysteries of our universe. I'm Keir Junos for CARPe diem.
Now, Preet, you know Professor Matthews.
Yes, he taught us undergraduate at UBC. This is years ago. Yeah. But good to see he's doing well now.
Yeah, it's a happy coincidence. But what is aphasia?
Right. So aphasia is a symptom or a set of symptoms that can result from a stroke affecting a certain part of the brain. Typically, the dominant left hemisphere in most of us is responsible for both speech production and understanding of the speech. So we typically say expressive aphasia or receptive aphasia. Clearly, as in Dr. Matthews' case, his expression was more affected than his reception. He was able to understand what Keir was saying. So these are sort of one of the common symptoms of patients' dominant hemisphere being affected.
What's interesting, from the heart side of things, we say exercise. And I would go one step further. I often tell my patients that exercise all your senses.
Very good advice. We'll be right back with our panel's final thoughts.
Still ahead on CARPe diem.
Regulation is the key, and the only person that's responsible is yourself.
Kindly get to know signs of stroke, know what strokes, how they can present.
You have to look after yourself. The way to do it is to know when to ask for help.
CARPe diem. Seizing the day for Canadians as we age.
Welcome back. It's time for our panel's final thoughts. Dr. Ara?
Well, my final thought is regulation or balance of your autonomic nervous system, especially the vagus nerve, what we're really talking about. You could regulate your vagus nerve through multiple activities, as we mentioned before, from praying to meditation to healthy eating, etc., because regulation is the key. And the only person that's responsible is yourself.
Well said. Yeah, very well said. And to take upon that, I mean, I think prevention is still the key in what I do, but I also, through this medium, others tell patients and patients-to-be kindly get to know signs of stroke, know what strokes, how they can present. For example, the FAST acronym, know it well. Not only when you see it yourself, but other people around you are having symptoms, you're able to access 911 and know the definitions and know what TIA could be, so that, once again, these symptoms are not ignored and right medical personnel are involved quickly if should anything bad happen.
It's good advice. Don't ignore the
Yeah,
signs.
absolutely.
And what about you, Dr. Shanta?
The human body, with proper input, proper exercise, proper diet, proper emotional health, etc., can revert back to a substantial extent. And I would agree with both of you. You have to look after yourself. The way to do it is to know when to ask for help. And when you are at your best self, then you can look after others. So other thing would be to look after others.
Live life with heart.
Absolutely. And the brain and everything else.
Live it well. Thank you
Yes.
so much, Dr. Era, Dr. Preet, and Dr. Shanta, for sharing your knowledge and inspirational show. Thank you so much.
Thank you.
Now, if you'd like to see a conversation at this table, get in touch. And that's the show. Remember, as our CARPe president, Moses Neimer, always says, the best way to keep going is to keep going. So, CARPE diem and seize your day.